Hi, I'm Dr. Jordan Robertson. I'm the owner of The Confident Clinician, a resource for naturopathic doctors to better support their patients with evidence based protocols. Today, we're going to complete our patient education series on frequent urination. This is a very common symptom that you may be experiencing as a patient. And one of the things I want you to take away from this video is realizing how important it is that you track your symptoms to be able to communicate them well to your doctor so they can get you on a path towards feeling better with respect to your urinary symptoms. So, frequent urination is a very common symptom in patients. The reason why people have urinary frequency is different. And this is where we need you to do some detective work so that we can better understand your experience. Communicating why you're urinating, the symptoms that are coming around those frequent urinations will help you get the treatment you deserve. So, we're going to review the things you need to track for your practitioner so that you can best communicate your experience to them. So, urinary frequency, meaning going very often, multiple trips to the bathroom, can happen for a lot of reasons. Sometimes patients are going to the bathroom all the time because they're worried about their ability to control their bladder. If you're struggling with incontinence or you have fear about losing control of your bladder, that's a specific reason why you may be heading to the bathroom more often. It's to try and avoid that unpleasant accident of having incontinence. For some people, they are urinating frequently to avoid discomfort. So, a full bladder may bring the symptoms of pain or pressure, or may feel irritated to have that full volume of urine in the bladder. Those patients may urinate frequently to avoid discomfort. Sometimes people are urinating more frequently because they have symptoms associated with their urogenital area, whether you're male or female, that have changed with age, that change the way you experience your bladder. And so that sensation of needing to urinate may happen more often if you, say, struggle with vaginal changes due to aging or prostate changes due to aging. So it's important that we keep track of why you're struggling with urination so that we can tell your practitioner what's happening. The other reason we need you to track your symptoms is because many of the solutions that we provide patients for urinary symptoms reduce your number of bathroom trips by 1 or 2 times. Now, that may not sound like a monumental improvement, but if you were only waking up in the night to go 1 time instead of 2, we would see that as a big success in your treatment plan. But that means we need to know how many times you're hitting up the bathroom during the day and at night, and that feeling you have when you go to the washroom so that we understand if your treatment is being affected. So, whether or not you're urinating to avoid pain or to avoid that fear of incontinence or for some other reason, we want to keep track of that. We also want to track your number of daytime and nighttime urinations and the feeling of urgency that you might experience when you are going to the bathroom. We definitely, when we struggle with incontinence or other urinary symptoms, start to form habitual bathroom breaks, and maybe you've spied out where all the bathrooms are in your regular day routine. As you get supported by your practitioner, the urgency to use those bathroom breaks may go down first before we adjust our habits of hitting the bathroom all the time. So it's important that we keep track of that as well. Once we've noticed whether you are going to the bathroom because of incontinence, because of discomfort and pain, or perhaps for another reason, that may help your practitioner adjust your solutions to give you something that's going to support your individual needs. Some of the solutions that we offer as integrative medicine practitioners and evidence based naturopathic doctors may be adjusting your nutrition. There's an impact on your nutrition and your nighttime urination. We may use something like hormone replacement therapy to support frequent urination in a person who is advancing into menopause. We certainly want to treat that underlying cause of prostatitis in patients who are having urinary symptoms due to prostate health, or we need to support patients for painful bladder syndrome, which you may have been heard called interstitial cystitis in the past. So those solutions are going to be built from how well you track and how carefully you track those urinary symptoms. We want to know exactly why you're experiencing the symptoms you are so we can support you the best.